So, your GLP1 stopped working. What can you do? Are you unknowingly sabotaging your anti-obesity medication? One thing to remember is the GLP-1 is a tool to help you achieve weight loss. It is not a cure. First question, how long have you been taking your GLP-1 and how much weight have you lost? These medications will not cause you to lose weight indefinitely. You will reach a homeostasis point. The question really is, have you maximized your response and what can you do to push that homeostasis point closer to your goal? If you've lost 5 to 15% of your body weight and then stopped losing weight, it is possible you are at your GLP-1 homeostasis point for that dosage. If you have not been taking the medication very long and have not achieved weight loss, it may be as simple as you need to increase your dose. Before we talk about increasing dose, let's look at some common causes of a weight loss journey coming to a plateau. Along with homeostasis, it's important to understand titration levels. The studies that people refer to with these 15 to 20% weight loss numbers were done with the patients at consistent drug titration levels. That means taking your medication as scheduled. If you delay your scheduled shot, it may negatively affect your titration level and how well the drug works for you. Pick a day and a time, put it in your calendar, stick with it, and don't miss your injections. Let's touch on diet. Are you maintaining protein intake and eliminating highly processed foods from your diet? We need to nurture your muscles, so protein is very important for maintained weight loss. If you lose muscles, you make it easier to gain weight. Cut out fast food and the preservatives. The preservatives and highly processed food affect the hormone pathway on which the GLP-1s operate. Avoid the processed foods and make sure you get your protein. Get 30 grams of protein in each meal, landing you around 90 to 100 grams per day. Also, as time goes by and weight loss is achieved, it is common for the caloric intake to creep up. Have a food diary to be enlightened on what you are actually consuming. This is important even after you've been on a GLP-1 for some time. People have a tendency to allow their diet to slip as time goes on, and they've lost some weight. Don't lose your momentum. Keep that food diary going to closely monitor your actual intake. Don't take weekends off. You can undo your whole week of healthy eating in 2 days of indiscretion. What about exercise? I see it over and over again. Do you want to know the one thing consistently found in people who maintain weight loss? It's continuing a consistent exercise program after their weight loss. You can't continue your exercise program if you don't start one. So make sure when you start a GLP-1, you are starting a consistent, resistant exercise routine. People who start or continue an exercise regimen on these medications get way more bang for their buck. Revving up the metabolism and maintaining muscle mass just keeps the weight coming off. If you are not strengthening your muscles, you are not going to get the potential benefit you could from these medications. Additionally, if you lose your muscle, it just takes less food for you to gain weight and you will pack on the pounds easier than prior to the medications. You just simply don't have the fat burning potential that you lost by letting your muscles atrophy. Let's discuss mental health. Your body cannot exist without the mind. In weight loss, your mental health directly affects what your body does with the calories and will affect where your homeostasis point will fall. If you are feeling down or anxious, it is important to seek help. It's always helpful to get counseling, and you may even benefit from medications if your mental health professional finds that appropriate. Hormones. The GLP-1s work on the incretin system. What is that, you ask? That is the hormonal circuit that controls your GI system. Let's talk about 2 things that affect hormones, especially in women. If you are peri- or postmenopausal, you may need to get on HRT. HRT does require blood work, pap smears, and mammograms. This is something you should discuss with your GYN. You know what else affects your hormones? Sleep. If you are not sleeping, then you are activating your stress hormones, specifically cortisol, which will ultimately end up doing the opposite of the GLP-1 you are taking. So prioritize your sleep. To sum it up, I often tell my patients, the more sleep, the more weight you will lose. Small behavioral alterations like consistently going to bed at the same time and waking up at the set time can restart the weight loss in sleep-deprived patients. Let's talk about medications and toxins. If you have started any new medications, you should investigate if these are associated with weight gain. The big culprits I usually see are antidepressants, steroids, insulin, and the sulfonylurea diabetes agents. Weight gain is associated with many medicines, so look at what you are taking. Also, alcohol. While alcohol is not a medicine, it is certainly a toxin which affects your liver's ability to metabolize your GLP-1. In addition to the calories that alcoholic beverages add to your daily intake, they also undermine the GLP-1's ability to do its job. Let's talk about a system reset. Resetting the system. Okay, so if we've maintained your titration levels, followed a nutritious diet, got your resistance training on a consistent routine, addressed psychosocial stressors and addressed menopause, and made sure you're getting good sleep, and you've researched the effects of your other medications, what else can you do? At HPC, we've had anecdotal success with a system reset. If it is safe for you to do a day or a couple days of keto to reset your system, that is something you can try. Oftentimes, this is all it takes and patients are back on the weight loss train and feeling back in control. If that fails or is not right for you, it may be time to consider other anti-obesity medications. If you have maxed out lifestyle changes and increasing the dose is not the answer for you, we can explore polypharmacy solutions. Are you already on other anti-obesity medications? There are stimulants such as phentermine. There are digestion impairment drugs like orlistat, combinations like naltrexone, bupropion, or topiramate, an anti-seizure and migraine medication that is associated with weight loss. Additionally, a relatively safe medication also intended for diabetes and prediabetes is metformin, which is associated with weight loss. All of these medications have side effects and require a visit with your doctor. To wrap it up, what can you do to start losing weight again? Well, you can raise the dosage, avoid processed foods, make sure you got resistance training, correct hormonal imbalances and get sleep. Stop other medications associated with weight loss. Avoid alcohol. Make sure your medication administration is consistent. Consider a system reset and talk to your doctor about adding other anti-obesity medications. GLP-1 resistance is rare. If you do all of this and you continue to gain weight and your thyroid studies are normal, there is a rare chance of GLP-1 resistance. If your A1C increases by a point in 3 months, or you are having paradoxical hypersensitivity with nausea or worsening nausea on a GLP-1 without the benefit of weight loss, you may have GLP-1 antibodies. It is important to note that a person can have GLP-1 antibodies and be asymptomatic or still lose weight on a GLP-1. So the science behind GLP-1 resistance is still being hammered out. Thank you for listening. I hope this information assists you to make the right decisions and empowers you to stay on your weight loss journey. Thank you for watching. Please subscribe to our channel for more information to assist you on your wellness journey.